Ready? Hi guys, this is Mrs. Sager again. We're going to be working on irrigating a Foley catheter today. So again, you want to make sure that you know what the doctor's orders are. Make sure you have an order to do this. Why would you have to irrigate a Foley catheter? Well, let's just say all of a sudden your Foley catheter is not draining urine. There may be a clog, and how does a clog happen? It could be a little blood clot. It could be just mucus in there. Has clotted off the flow of the urine. So what we want to do is check the doctor's order, and yes, we do have an order for to irrigate. Then we want to get an irrigation tray with a 60 milliliter syringe. And you're going, wow, that's really big. And it is. It's quite big. It's a syringe like this. We need it to be able to instill a lot of liquid in, okay? And what we want to do is then get some normal saline, just a bottle of normal saline. And you can, if it's a small bottle like this, you can actually use this bottle to draw up your liquid, because you're just going to throw it out. If it's a bigger bottle, you can pour it into the bottle that's provided for your kit. So you instill the liquid into your bottle here, and then you want to take your cover so that you don't get the bed all wet. Oh, look at this, isn't it? There we go. Remember the two sides. You have a not shiny side, and then you have the shiny side. The shiny side you want towards the bed, because that's to keep the liquid from getting on the bed. Put it underneath the area that you're going to be working on. We have the male's anatomy here, okay? Oh, yes, by the way, you did your wipes, okay? So you did all of that. I'm not going to go over that because we're not first semester anymore. We're moving on. Now we want to disconnect the Foley from the leg bag, because right at this moment we need to manipulate this a little. Now, within this, you're going to be working with the Foley catheter. So you want to disconnect the bag, the tubing, from the Foley catheter. So how you do that is there may be tape on here that you have to remove if it came in a kit. If not, you're just going to work it off. Now, mind you, be careful that you're not pulling on the Foley catheter when you're trying to do this. So you want to make sure that that you give some slack down here, and you want to just manipulate it till you get it off. You see how I'm not really pulling on that catheter. Now we want to try to keep this, we have to keep this clean, so we don't want this to touch the floor, the bedding. We don't want to be doing this. We want to keep it clean. How can you do that? Well, if you don't have somebody to hold it, you can get a cap and put the cap on it, or you can just hold it in your hand like this. You're going to have to be able to be ambidextrous when you do this, okay? Now you want to take your syringe, and you want to draw up some liquid into your syringe, okay? We've drawn up the liquid. Then we want to take, I forgot to move this down here. Why am I moving this down here? Because we need something to collect the fluid in after we've irrigated. All right, so then you put your syringe inside of your Foley catheter. Explain to your patient that this may be just a little bit uncomfortable, because think about it. We're putting fluid into the bladder. The body usually puts the fluid into the bladder, and then we usually urinate it out. So this may be just a little uncomfortable for them, okay? So what we're going to do is we're going to push, and you should be able to push it in. There may be a little bit of resistance there because you are unclogging whatever's there. Now, you should be able to draw back the same amount of liquid that you put in. If not, and you see I'm not getting back what I put in, you can let it free flow into the container, and this is not going to do it because the bladder is not full inside the mannequin. So what can we do? We can instill some more. And are you going to have to do this 1 or 2 times for your patient? Sure, you may have to. You may have to do it 3 or 4 times. Again, push. Make sure it's not hurting your patient. I can hear it going into the bladder in the mannequin. So it's really a weird sound. And it's not going to come out for us. But it would flow back into here. Let's see if I can put a little bit more. And I want the flow to happen for you here, okay? So that's what I'm trying to do right now, is to get a flow going for you. If I put enough in there, maybe. It's a really big bladder in there. And it's just dripping out. So you get the drift. You continue to do this, and you can draw back and see. What you want to do is you want to make sure that you keep track of how many milliliters you put in, so that you can know if you're getting fluid, your fluid, or urine back afterwards. And also, that's an intake, right? Because we're instilling liquid into the body. We were going to need to know how much we're putting in. That's part of your intake. At this point, you can put your foley catheter, put your foley back onto your foley bag and connect it to your leg bag, your leg strap. So that it's not pulling, remember? And then you're going to monitor this for a little while and see if you get the urine back, or if you start getting urine coming out of the catheter. And that's how you irrigate a Foley catheter. Hi, it's Mrs. Sager again. Okay, this is our last video concerning, I think I see orange, yellow, excuse me. We're going to be doing catheter, Foley catheter removal. Again, doctor's order says to remove the Foley. You come in, you do wipes, you do all of that. You move the bed up, you got it, okay? Now, what we're going to do is we're going to actually remove the Foley catheter from this person. So we want to either A, remove it from the leg band, or remove the leg band from the patient, whichever is easiest, okay? We want to have that all ready to go. Next thing we want to do is take your semi-permeable piece of cloth and put it underneath so that you're not making a mess, because sometimes you make a mess when you do this, okay? Second of all, we need a syringe, at least a 10 milliliter syringe. We just don't know how much fluid is actually in that balloon within the Foley catheter. So we want to have at least a 10 milliliter syringe. We're going to remove the fluid. I put this in so I know that there's 5 milliliters of fluid in there. And so I'm going to draw back and get 5, okay? So now that the fluid is out of there, I'm going to tell the patient to take a breath and breathe. And we're going to remove this Foley catheter, okay? And then make sure that it drains, all the urine drains down into the bag. Then you take the Foley catheter itself, the catheter bag, if I can get it off the bed. And yes, you struggle with it. And there's urine in there, so you empty it into your, whatever it is, the urinal graduated cylinder, and you chart the fluid, the urine that came out. You clean it up. You tell the patient, that they need to let you know when they have to go to the bathroom next, or when they do go to the bathroom next, because we need to chart that they're able to urinate after the removal of the Foley. That's very, very important because we may have to put the Foley back in if they aren't producing urine. So we have to monitor that. And then you would chart everything, and that's it. That's how you remove a Foley catheter. Easy, isn't it, guys?